world is still struggling with water shortage, hygiene and sanitation crisis that has been exacerbated by climate change. As we race towards achieving 2030 Sustainable Development Goals, Kenya is still not on track in achieving universal access to water. My name is Beldin Walieula, and on this episode of Health Digest, we look at the impact of poor water coverage in Nakuru County. In Nakuru County, residents here have no access to water daily. The prolonged drought has made underground water to dry up, and now residents have to cope with rationed water. Agnes Makori has been living in Kaptembwa, Nakuru County for more than 23 years, and she says the water shortage is not getting better despite the current rains.
Kwa hivyo imekuwa tu hali ni ile. Maji ni mara 2 kwa wiki na inakuja kwa masaa. Especially wakati wa mvua, kama kuna mvua inaweza kuja kitu kama masaa 4, lakini kwa sasa wakati wa kiangazi ni masaa 2.
Our current supply coverage for water is about 66%. And our current coverage for sanitation is about 17%. So that tells you that there is a good percentage of people that do not have adequate access to water and sanitation.
Residents here have resorted to buying water in water kiosks, and those who are unable to do so end up using contaminated water from nearby rivers.
Kwa kibanda maji ni shilingi 5 kwa mtungi. Sasa itabidi pengine kama utatuma mtu pia utamulipa shilingi 5 kwa mtungi. Hivyo ndio vile gharama ilivyo juu. Sasa hata sisi pia tunashanga kama pengine wakazi wa hapa, kwa nini maji iko kwenye kiosk kila siku na si kwenye ploti na hatujashindwa kulipa.
Agnes claims the water shortage is now posing health risks to many, especially now that the river they all depend on is dry and contaminated.
Ni upande wa afya. Of course lazima mambo na magonjwa kama ya kuhara yatakuweko sababu hakuna maji. Kwa hivyo mambo na uchafu itakuwa hali ya juu ambayo ita attract mambo na diarrhea. Kwa hivyo cases za diarrhea pengine statistics za hospitali za around zinaweza attest ya kwamba cases za diarrhea zinakuanga juu, especially wakati wa kama huu ambapo hakuna maji, kwa sababu wengine wanahitajika kando nilivyosema hapo mbeleni na maji ya vibanda, panakuanga na mtu ambao unapita mto Ndarugu. Wakati una maji yale inasmacha si yanaonekana ni maji chafu, lakini yale maji yanamsaidia mwananchi katika mambo na kufua. Such that ile maji anapata ya siku 2 ya wiki anahifadhi kwa sababu ya kupika na kuku na kuso mambo na magonjwa yako. Yale maji yanatumika pale kwa mtoni pia si maji mazuri.
Also, poor sanitation in the outskirts of Nakuru city is a major challenge. The sewage system is not sufficient for all residents, and drainage systems end up being flooded with waste during rainy seasons.
Kuna landlords hawakuweza kujenga hizi septic tanks. Hata kama hiyo water works ilikuja kwa wapatia subsidy wakajenga power flush toilets. Wengine wenye wanaishi karibu na hizo drainages hakuna cha kujenga hiyo septic ama hiyo conservancy. Imeconnectiwa kwenda kwa drainage system. Sasa wakati tu mvua ifanye tu kunyesha hivi, ndio inafunguliwa yote inaingia hapo. Ingepatiwa tuseme hiyo fursa ni waongeleshe. Wangetafuta vile wanaweza kupata mabomba ya kuhifadhi maji wakati maji yako. Kuna hii jambo la rain water harvest aliko na maji mengi wakati mvua itanyesha Nakuru, hata kama itakuwa inanyesha kwa muda inanyesha, maji ni mengi yanaenda into our waste. Kwa hivyo wangepata njia ya kuhifadhi yale maji wakati mvua inanyesha. Hii mambo ya rain water harvest, unajua manyumba yamejengwa sana na maji yanamwagika ni mengi. Yale maji yaweza tu kuhifadhiwa wakati ambapo kuna msimu wa mvua. Yale maji yanasaidia wakati wa kiangazi kama saa hizi.
The county, however, defends the move of having water kiosks as it assures all residents constant supply of water.
We are talking of accessibility. In a kiosk, you will realize that more people are able to access that water than when you actually directly regulate the water to the houses. And again, this also has to do with probably the landlords. You see? Landlords themselves sometimes they are not fast like in paying water bills. So then when they are not, I mean, fast in paying water bills, then probably you might even realize that the residents are not aware, but probably they have been disconnected. Problem with water projects mainly in Nakuru County has been the issue of mismanagement by the community, because mainly this projects are run by the community. And now we are thinking as a county that we want to ensure that most of these projects are managed or run by a water service provider. These are the people who are licensed by the government to ensure that they manage and run water services for the community. And in this, we will ensure that at least we are sure, because you go to ground there, you realize that people are not drinking water over very small things. Maybe the water got burned, they have not been able to replace, maybe they are not able to pay electricity for some time. And some of these things these are things that as a county government, we believe that we'll be able to fix this thing quickly by involving the water service provider.
But for now, residents of Nakuru town will have to deal with water rationing until a sustainable solution is found.
The rationing will continue for a while, first because of the population growth rate. Now that we are already a city, everyone wants to come and stay in the city, but the sources are not increasing. The current supply for Nawasco, for instance, is 40,000 cubic meters per day against a demand of about 75,000 cubic meters per day. With the growth of the city and the population due to the city status, we are expecting that demand to go up to around 85,000 cubic meters per day. Rainwater as a county, we have embraced this by first doing ponds and dams, ensuring that the water does not run down into the ocean. So at least we conserve some a bit of water. We've done several ponds and several dams within our area. We have also started a program where we are distributing water tanks for harvesting in households. We had tried a large-scale water harvesting, rainwater harvesting, but unfortunately, because of limitations of land, we could not be able to accommodate such a big project whereby we would harvest rainwater, have it stored and treated for distribution. So the most we can do currently is to do sensitization to households to ensure that they embrace harvesting of water.
The situation is different in Naivasha sub-county. The available boreholes can sustain the growing population.
Na hivyo Wasco tunafanya nao kazi vizuri, wanatusupply na maji na hakuna rationing. Na kama wakati watajua maji itapotea wakati wanafanya maintenance, wanatuandikia message in advance. Na ikienda sana inaenda siku mbili alafu inarudi. Kwa hivyo tutapata shida yote ya maji.
Right now we are serving about 11,900 connections. Those ones are we have multi-dwelling units. That is a connection that is serving more than 20 households. We also have communal water points, about 90 kiosks. Then the rest are household connection. We also have commercial and industrial connections. Yeah.
Naiva Wasco, the company that supplies residents with water, having had digitized its operation.
We rely so much on groundwater sources. And what happens is that boreholes are not really affected very fast by the changes in climate. So they have a bit of resilience when it comes to climate changes. So most of our boreholes are still able to produce more than what we need right now. And therefore we're able to supply to all our customers for 24 hours, unless we have an issue like bursts or power issues. Part of our strategy is to enhance communication with our customers. We try to engage with them. And some of the things that we also try to do is to inform our customers in case we have any challenge with supply. So where we project and we think that we might have any challenge, we communicate with them, or where we have any challenge, we're able to tell them how long we expect that challenge will last. And once we resolve it, also we're able to communicate.
The county government of Nakuru is now hoping that the completion of the Itare Dam, which stalled, will help supplement the provision of water for Nakuru's growing population.
So once Itare is done, I think it will be able to give us sufficient amount of water. Actually, I think we will be slightly above the demand. We'll be slightly above the demand. can't get the figures correct, but I think we'll be slightly above the demand. But in due course, as we wait for ITARE to be actualized, we have taken up some measures. We have identified a number of good aquifers just within ourselves. And what we are going to do now is we are trying to gazette. We are trying to gazette these wells, so that now nobody else comes and probably build a structure up or something like that.
Nakuru is, however, facing another problem related to water. The level of fluoride found in the water is high, thus affecting its quality.
Yeah, so even if we did more boreholes, the areas that can be done boreholes are limited because of quality issues. There are areas that you drill a borehole and the fluoride levels are so high that that water is not fit for consumption. Yeah.
Have you found a solution for this fluoride issue?
For large-scale production, we have not found. For small scale, that is for households, we have CDN, Catholic Diocese of Nakuru. They had come up with boncha, which is a method of defluoridation, but that is on small-scale basis. That was mainly for household consumption, for drinking purposes only. But for large scale, what Nawasco and other companies within Nakuru County are doing, they are trying blending by getting water from sources that are of reliable quality and blending with the borehole water, which is highly loaded with fluoride, to reduce the concentration. Some of the blending sources are the surface sources, like the rivers, which I've said they have dried. Like this period, dry period, most of the rivers have dried up. So we end up having boreholes that are of relatively high fluoride levels, being the main supply of water.
As Kenya races towards achieving 2030 sustainable goals, only 62% of Kenya's population has access to water, while 67% of the population does not have basic access to sanitation. The inefficiency of the water supply is making many to be vulnerable to diseases. Half of the world's population, approximately 3 billion people, do not have safe sanitation at home, while a quarter of the world's population do not have safe drinking water at home, whereas an estimated 2.3 billion people do not have a place to wash their hands with water and soap.
A number of challenges. I can categorize them into around 5 main areas. One is about the slow sector reform. You know, the sector reform in Kenya started way back in 1999, which went to the Water Act 2002. And then so the country has been on a very good trajectory of sector reform. But the rate is very slow. The uptake of the reform is very slow, particularly in the arid and semi-arid lands. Because the country is now at 54%, but in some areas it is between 10 to 20% the coverage of the utilities. So commercialization of water services has not been fully taken up, and this is something that we need to accelerate for us to have universal access. That is one area. And the second challenge is about governance of water services. So even where we have the utilities, the governance is very poor. We have non-revenue water, which is at 45%. You have treated water, released for supply, yet the 45% of that water is lost. And globally, the rate is below 20%. So if we look at the impact report of produced by WASREB last year, it was released last year, June, they're saying the country is losing 10.5 billion Kenyan shillings, which could have been used to improve extra coverage, extra investment in supply, to improve reliability. So governance is a major issue. Another factor is around maintenance, operation maintenance. You'll see a lot of systems that are not working. In UNICEF, we assessed 10 counties affected by drought, and we found that over 1,000 water sources were not working. And we helped to rehabilitate some of them, but that cannot be a solution. We need to have a longer-term solution for operation maintenance.
Several WASH programs going on, like construction of toilets within schools. We also have, like UNICEF assisted us in construction of hand washing facilities, in health facilities and in schools, construction of kiosks in areas that are low income areas, and provision of soaps for schools to wash their hands and to ensure that they are maintaining proper hygiene. There is also provision of tanks in schools, which we are doing as a county and also through the water companies.
Today, 1.42 billion people, including 450 million children, live in areas that have water scarcity and they do not have enough water to meet their everyday needs. UNICEF, with its partners, is implementing wash projects in Nakuru, Nairobi and Homa Bay counties in a bid to push for universal access to water, but there are still challenges with governance of water services.
In UNICEF, we assessed the 10 counties affected by drought, and we found that over 1,000 water sources were not working. And we helped to rehabilitate some of them, but that cannot be a solution. We need to have a longer-term solution for operation maintenance, perhaps through better, capacity on maintenance, change of culture of the water managers, both at utility and county and national level, towards better maintenance. The other challenge is the drought, which is exacerbated by climate change, the drought and floods. Now it has rained the last 3 days, 1 week it has rained, and you've already seen cases of floods. Yeah. The other day it was a drought. So how can we have, better adaptation to the climate change that we are observing? So then we can improve on better storage of water, which can then be used during the droughts. Even the borehole yields have declined. Yeah, and if we can really have better catchment management, we could recharge the groundwater so that even during periods of drought, the yields of boreholes will not have reduced. Actually, access to water has reduced. In the last survey, the impact report by WASREP, the per capita water use was 31 liters per person per day, while in regulated utilities you're supposed to have 50 liters. Even you as a household, you need to have to 50 liters per person per day, but we had 31. In the ASAL counties, the arid and the semi-arid, the situation is even more worse. It can go up to as low as 5 to 10 liters per person per day. So, because the yield from the boreholes have gone down, surface water sources have dried, and where the boreholes are working, then there's high non-functionality because of the high utilization and the breakdowns and the also lack of operation maintenance. There's a lot of non-functionality of the boreholes.
Kenya at the moment is lagging in achieving sustainable development goals for drinking and sanitation, and an immediate turnaround is needed to accelerate water service delivery. Currently, only 38% of Kenyans have access to basic water services, while 67% do not have access to basic sanitation. With the country now prone to cyclic drought due to climate change, how can the country have better adaptation?
Of water now stands at 54%. It needs to go to 100%. So we need to influence national and county governments to see that they develop a county water service strategy that defines where are these people who have no water, how many are they, and where are they located, and how can we reach them. So that we will do that, and we'll monitor that through effective coordination. Unless there's coordination at county and national level, then we cannot track progress. This has been lacking. We were somehow better, the country was somehow better in the time of 2006, 2007, when there was the annual water sector conference. But this has declined over the years, and we want to revive this annual water sector conference, improve coordination, county government-led coordination at the county level, at subnational level, so then we can have joint planning and track progress.
Children are the most impacted by the low water coverage, as lack of water also affects households' food security.
Once you don't have adequate water, then it affects the amount of water you take for drinking, whether you have quality water for cooking, and water for hand washing, for sanitation, and this suscepts children to disease outbreaks. You have seen now that in the last 6 months there was cholera outbreak in the whole country. Almost 17 counties were affected, and the children are the immediate ones who are weaker for this. In addition, water is not available even for livestock, and even where the water was not available, livestock have migrated. So this reduces the amount of milk available for children to drink. Some of the households are practicing small gardening using the water available, but now they cannot do it when there's limited water. So even getting vegetables, getting nutritious diet for children is a problem. So water is actually the major determinant, both for health, but also for food security and livelihoods.
Last year, in October, the Ministry of Health issued a cholera alert following confirmation of 61 cases reported across 6 counties in the country, which is being attributed to the prevailing droughts and low water levels across the country. The outbreak has since spread to 17 counties as of 28th of February this year.